Hi, I'm Mike Zaretsky, Medical Director of the Colorado Fetal Care Center located at Children's Hospital of Colorado. I wanted to discuss recent results from research impacting monochorionic twins treated with laser ablation for twin-twin transfusion syndrome. Laser ablation is the standard of care for the majority of cases of twin-twin transfusion syndrome, and survival has significantly improved over the last 10 to 15 years. However, despite this improvement in survival, prematurity remains the main limitation of fetal intervention and a major contributor of neonatal morbidity and mortality. As a result of both twin-twin transfusion pathophysiology and complications from intervention, premature birth is expected as well as anticipated. Prematurity not only leads to excess morbidity and mortality in neonates, but also it is an independent contributor of poor neurodevelopmental outcomes. In fact, it has been demonstrated that a lower gestational age of birth is the only factor independently associated with neurodevelopmental impairment. Because of the important contribution that prematurity makes to the outcome of twin-twin transfusion syndrome, we undertook this research to further refine our understanding of the timing and indications for delivery after laser ablation from a large multi-center cohort of patients from within the North American Fetal Therapy Network, otherwise known as NAFNet. NAFNet is a consortium of 35 medical institutions in the United States and Canada with interest and expertise in fetal surgery. 11 of these NAFNet centers conducted a retrospective review of cases of twin-twin transfusion that underwent laser ablation. Indications for delivery were divided into both maternal or fetal, and then fetal indications were divided further into whether it was related to the donor twin or recipient twin. A large number of patients with 847 twin pairs were included in this study. The average gestational age of delivery for the entire cohort after laser was just shy of 31 weeks, and the average latency, or the time from laser ablation to delivery, was 10 weeks, thus confirming a low gestational age at delivery following treatment for twin-twin transfusion. Indications for delivery after laser were related to the mother, in 79% of cases and related to either the donor or recipient fetus in 21% of cases. The top three primary maternal indications were spontaneous labor, premature rupture of membranes, and surprisingly, placental abruption. The top three fetal indications were non-reassuring fetal status of the donor, Doppler blood flow abnormality in the donor, and fetal growth restriction of the donor. Thus, indications relating to the donor fetus predominated. We found that treatment of early-stage twin-twin transfusion was associated with a later gestational age of delivery, and that suggested the benefit of prompt diagnosis and treatment of twin-twin transfusion syndrome. So to summarize this research, patients undergoing laser ablation for twin-twin transfusion syndrome may be counseled to expect approximately 10 weeks of time from laser treatment until the time of delivery and deliver at an average gestational age of 31 weeks. Maternal indications for delivery predominated with spontaneous preterm labor and preterm premature rupture of membranes as the most common contributors to prematurity. The high rate of placental abruption was surprising. It accounted for 8% of maternal indications for delivery, and future research will need to explore this further. Fetal indications mainly relating to the donor twin were responsible for 21% of deliveries. Finally, treatment of early-stage twin-twin transfusion was associated with a later gestational age of delivery, which suggests a benefit of early diagnosis and treatment of twin-twin transfusion syndrome. Further research is desperately needed to investigate ways to reduce premature birth following laser ablation in order to make the next large leap in survival for twin-twin transfusion syndrome. If you would like more information, please visit our website. Thank you.